Cancer disease. What is cancer? Cancer is a disease in which an individual's body cells grow uncontrollably and can spread to other parts of the human body. Cancer can initiate in most parts of the human body and can destroy healthy tissues, including organs.
About the disease. Cancer originates when the cells in a certain part of the body begin to grow out of control and the growth of the cell is abnormal. Cells become cancerous due to the damage created in the DNA. Once the DNA is damaged, it cannot be repaired and it dies, which then goes on to create unnecessary cells that the body does not need. Cancer spreads as cancerous cells tend to often travel to other parts of the human body and begin to grow and form new tumors.
Causes of cancers include genetics, chemical exposure, viruses and bacteria, smoking and alcohol, radiation, diet, and lifestyle.
To go more in depth, the genetics section, the DNA that carries instructions to make a protein are several proteins. Changes in these genes can lead healthy cells to become cancerous or majority cancer cell occurs randomly because of this. Smoking and alcohol, just like we all know, chemicals in the cigarettes can cause lung cancer or cancer in the lungs. Severe alcohol consumption can also cause damage to the DNA, which leads cancerous cells to develop. In many chemicals, there's also many chemicals that can cause cancer and cause cancer mutations.
Other types of cancer also include radiation. High energy radiation can damage DNA. It can lead to cancerous cells forming. That includes X-rays, gamma rays, and ultraviolet rays. Also, everyday products such as our cell phones can lead to cancer. Another form of cancer is viruses and bacteria. Viruses enter a living cell and enter their own DNA into their host. This affects the DNA as the host cell genes can lead the cell to become cancerous, and several forms known as carcinogenic bacterial metabolites. Diet and lifestyle is another cause of cancer, as high fat and low fiber diets can lead to many forms of bowel, lung, prostate, and uterine cancer. However, having several lifestyle choices, such as exercise, can be a determinant of whether a person has a risk of developing cancer.
Signs and symptoms are different for women. For women, we have abnormal vaginal bleeding, pain in the pelvis or abdominal area, changes in breast, changes in bowel habits, and vaginal discharge colored with blood. For children, it's unexplained paleness and loss of energy, easy bruising or bleeding, ongoing pain in one area of the body, unusual lumps or swelling, frequent headaches, often with vomiting. And for men, it's change in one testicular, indigestion or trouble swallowing, persistent pain, change in your restroom habits, or persistent cough or hoarseness.
There are many types of cancer, more than 100 types of cancers. The types of cancers are usually named depending on where the cancer forms. For example, we have epithelial cell. This cell is the line that this cells is that the ones that line in the internal external surfaces of the body. We also have squamous cell, the cell that looks like a fish scale found in the tissues that form the skin on the surface of the skin. With many types of cancer, there are also different categories of cancer that begin in specific types of cell. Some of these categories include carcinoma, sarcoma, leukemia, lymphoma, multiple myeloma, melanoma, brain and spinal cord tumors. However, the most common cancers are breast, lung, colon, and rectum prostate cancers, accounting for 10 million deaths in 2020.
The categories of cancer there is carcinoma, leukemia, melanoma, lymphoma, and sarcoma. Carcinoma is the most common type of cancer formed by many different types of epithelial cells and are named differently, many of which include adenocarcinoma, basal cell carcinoma, squamous cell carcinoma, and transitional cell carcinoma. Leukemia is usually the cancer that is in the blood. Melanoma is the cancer that begins in cells that become melanocytes and specialized cells that make melanin. Lymphoma is a cancer that begins in the lymphocytes, abnormal lymphocytes built in the lymph nodes or lymph vessels. Sarcoma are cancers that form in the bone.
There are types of cancer. They are known as breast cancer, bladder cancer, colorectal cancer, lung cancer, prostate, and stomach cancer. all in which you can reference that they are in certain sections based on the names. Stomach is obviously cells grow out of control in the stomach. Prostate is found in part of the male reproductive system. Lung is actually the leading cause of cancer death, which is cancer in the lungs. Colorectal is found in the colon or rectum. The bladder is found in which the cells grow out of control in the bladder, and breast cancer is found in the breast.
So how do we prevent it? We usually get tested, vaccines, and healthy choices. Getting tested is like for women is for mammograms or pap smears, and if you're a heavy smoker, you should get at least one checked once a year. And vaccines, the vaccines that help with this is HPV and hepatitis B. For HPV, this will help more in the cervical cancer area, and for hepatitis B, this vaccine will help you with liver cancer, depending on the severity of your liver. Now, healthy choices, try to avoid tobacco products, limit your alcohol intake, keep a healthy weight, and protect your skin from sunlight and UV rays.
There are also types of cancer treatments. There's radiation therapy. This treatment is used to reduce the size of tumors. Chemotherapy, this treatment uses intense drugs to treat and slow down cancer cell growth. Next, we have immunotherapy. This cancer treatment helps the immune system fight cancers. It is a biological therapy type of treatment. Next, we have hormone therapy. This treatment reduces and stops the growth against cancer cells that use hormones to grow. Next, we have surgery. This is the most invasive type of cancer treatment, which involves a surgeon physically goes in and removes cancer from the body. And lastly, we have targeted therapy. This type of treatment targets specifically proteins that help cancer spread.
Now, to reduce risk, like I said before, limit your alcohol intake, get checked up yearly, eating healthy, and being active.
We have impact on U of H community. UHND is a collaborative partnership between the University of Houston and the University of Texas MD Anderson. And this program is to help promote health equity amongst racial and ethnic groups affected by cancer disparities. U of H campus is also located in the Cancer Belt of Texas, with Harris County accounting cancer rate for 393.5 cases per every 100,000. U of H also offers a college pharmacy that allows students to go and find opportunities as of cancer research.
Now, public health connections. We have biomedical, social behavior, and health policy management. Biomedical sciences really focus on finding new ways to prevent and detect cancer, while social behavior sciences help with prevention and prognosis. And health policy management is more of the expansion in federal and state marketplace that have expanded insurance and coverage.
We also have public health connections, epidemiology, and biostatistics. Basically, epidemiology just plays a key role in trying to control and prevent the risk and distribution of cancer. Biostatistics is just cancer has been known to be the second leading cause of death after heart disease in the US, and it's just basically keeping numbers and trends. You can find support. If you have any questions about cancer, just call. You can also go on livehelpcancer.gov or email nci.info@nih.gov. Then we have a Kahoot, which Maritza will be helping us live in person. And then these are our references. And we are